Open. Good morning. Today we're going to talk about sciatica. Probably one of the most humbling things, if you've ever had it, that you'll experience. The vast majority of sciatica comes on without trauma or some big event, meaning I lifted something heavy, although a lot of sciatica does occur when people bend, start to lift something, and twist. What is sciatica? People will come in and tell me I have sciatica. But really, the definition of sciatica is the sciatic nerve, which is a big trunk nerve about the size of your finger or thumb, that's responsible for innervating your whole lower extremity. That's why when you have true sciatica, it is so painful. Sciatica in this office, by definition, means that you have pain that radiates from your back, through your butt, down your leg, at least to the level of the knee and lower. So now that you have this sciatica, let's think about what's happening. You have a huge inflammatory event occurring in your back when this happens. The nerve is either entrapped in a muscle, or it's trapped in the hole where it exits the spine, or the disc may be pushing on it, and that may be causing this irritation and this inflammation. So typically, I'm making a joke here, but it occurs Friday night, and good old Dr. Frost isn't available. 48 hours are the acute inflammatory hours of sciatica. That means that almost like if I hit my thumb with a hammer, I would expect to have 48 hours of pain. But that is happening at the level of your sciatic nerve in your back as well. So what to do? No place to go. What can I possibly do to help myself? Well, the first thing people ask me is ice or heat. And I always tell them that ice is always right. And if it's an acute stabbing, sharp pain, which typically sciatica is, the application of ice is the best thing for you. What I will tell you is that as you apply the ice, make sure you apply it right at that crease where your low back meets your butt, and make sure that it gets down low. And when you put it, don't lay on it. Lay on your side so that the ice does not create a wedge that your back has to deal with. Use ice for 20 minutes in this acute episode every 1 to 2 hours. Don't overdo it. Don't give yourself an ice burn on your skin. That's number one. The second thing you can do to treat sciatica yourself is what I call a static back posture. I'm going to demonstrate it, you lucky people, and here it goes. Now, I'm going to tell you that you can use a chair, a couch, or an exercise ball, but this is what you're going to do. You're going to lay on your back, and you see how my legs are basically at 90 degrees with my body? Now, obviously, your head would be supported and you'd be lying in a neutral position, but your legs would be up. What is the purpose of that? The purpose of that is to take that pressure off the sciatic nerve. Now, does this work all the time? No. Does it work a lot of the time? Yes. And you can stay in the static back position as long as you are comfortable. If you all of a sudden have kind of maxed out your comfort and it starts to aggravate you again, then obviously come off of that posture. The second posture that you can use for acute sciatica is the fetal position posture. Again, the fetal position posture brings your knees up. So both knees are up, right? You're laying on your side in a neutral position, just as if you were in a fetal posture. Again, this does two things. Number one, it opens that joint in your back and hopefully separates out some joints so that it decompresses a little bit of that sciatica. The second thing it does, it again relaxes that sciatic nerve and takes the pressure off. So ice, laying on your back, static back position, and side posture, static back position. 48 hours. No relief. Call me. We'll take care of you. Have a great day.